Hey guys, welcome back to this YouTube channel. So we are continuing with interview series, how to go about some of the questions when you go for a nursing interview. So stay tuned. If you have not subscribed, kindly do so. Make sure you watch this video up to the end. Don't forget to turn your notification bell so that every time I post a video, you will be the first person to be notified. So guys, this is one of the most asked question when you go for a nursing interview, or rather when you go for any interview. This is the question that most of the time those interviewers usually ask. And this question goes by, or this is how they can ask it. Tell us about yourself. This is how they usually ask this question. Tell us about yourself. This is how you will go about this question. First, you should know that there are some of the things that you will talk about, and the employee wants to know these things that you want to talk about, that they will need to hear from you. So the first thing that you should start by saying, you should start saying, thank you for giving me this opportunity. My name is so and so. And from there, now I'm going to tell you some of these points that you will need to emphasize to talk about when you are asked such question. So let me say that tell me about yourselves is a general interview question that recruiters might ask during a nursing interview. Your reply allowed them to learn more about you and ensure you have the qualities of successful nurse, such as empathy and patience. Understanding how to answer this question and studying sample response may improve your interview performance. In this question, you need to tell this interviewer review the review the roles requirement, discuss your employment history, explain why you became a nurse, mention your educational background, and list your value in life and at work, and also discuss your strength as a nurse, and also you can also discuss your weaknesses. That is all that we are going to talk about, 6 to 7 points. So I said sometimes the reason why employers ask this question during nursing interview, tell me about yourself. Learning your employers, I mean, they want to know more about yourself, and they want to know or to get the reason why they should interview you, or they should give you that opportunity in case you will qualify. So let's start with the first point that goes by review the roles requirement. So as you are preparing for a nursing job interview, read through job description several times. This helps you to understand the roles requirement and decide which of your qualities you want to mention when an interviewer requests that you tell them about yourself. For example, if you are applying for a nurse manager role or just a nurse, you might, okay, for example, when you're applying for a nursing manager, you might emphasize your leadership quality, and this can include the ability to use shift management software or knowledge of motivational strategy that work well in the healthcare setting. And if you are just applying for a general nurse or just a nurse, or without a specialist or specification, you may need, or you might state some of the qualities, such as you're hardworking, you can communicate well, yeah, such kind of things. Point 2, I said you have to discuss with your employer employment history. So, talk about your employment background is an excellent way. Talking about your employment background is an excellent way to start answering. Tell me about yourself in an nursing interview. In this way, you can use your current position to introduce yourself and mention how long you have worked in nursing, or it can also help you inform recruiters or somebody who is interviewing you about your career focus or specialization, such as an adult or pediatric nurse. So if maybe you have worked in pediatric ward, you can mention that. If maybe you have worked in outpatient department, you can mention that. If maybe you have worked in maternity, you can mention that. Tell them about your employment history. The third point, explain why you became a nurse. And this one will give them an easy time, because most of the time you find that they can ask you in the same interview the reason why you became a nurse and or the reason why you choose your nursing as your career. So if you answer this when they ask you about tell me about yourself or tell us about yourself, you've already answered this. So how to explain the reason why you became a nurse? When an interviewer wants you to introduce yourself, consider using this as an opportunity to explain why you became a nurse. This might be especially beneficial if the reason for pursuing your career demonstrates your dedication, ambition, and genuine passion for nursing. As part of discussing the start of your nursing career, you can mention who or what inspired you to pursue healthcare. You can tell them maybe your dad was a nurse, and that is where you got the inspiration, or you saw someone helping the patient in a certain way, and that is how you got the inspiration of becoming a nurse. The fourth point, mention your educational background. Yeah, it is very important you mention your educational background. Another effective approach to answer this question involves discussing your educational history. After briefly explaining your work experience, list the qualifications you hold. Maybe if you are a diploma nurse, if you are a degree nurse, or if you are in still continuing with your education but you still have some qualification, you will mention that. Completing an undergraduate course is a requirement for all nurses, so monitoring your formal education help recruiter make sure you are qualified for the role. It is also advisable to mention the title that you hold. So for example, you may introduce yourself as you can say I'm a registered nurse and a member of nursing council, or a nursing and midwifery council. The fourth point, list your values in life and at work. Use your answer to tell me about yourself question to list core value by monitoring value that organizations, by mentioning values that the organization with which you are interviewing also represent. You position yourself as an ideal candidate whose career goals are likely to align with the employer's objective. As a healthcare specialist, some value you might discuss include empathy, willingness to comply with the nursing code of ethics. In addition, consider centering your answer around the 6C. I know maybe you already know this 6C, and these 6C are the commitment to quality of care, compassion, care, competency, communication, and courage. Those are the values that you should mention when you have been asked to tell me about yourself in a nursing interview. Point 6, discuss your strength and weakness as a nurse. As you introduce yourself and sharing facts from your life and career, you might structure your answer to talk about your strength as a nurse. When deciding which qualities to share, consider the facility where you want to work and the employer's goal. For example, if you know that the organization plan to increase the size of its nursing team, adaptability might be a beneficial characteristic. And depending on the stage of your career, consider mentioning knowledge-based, transferable, or personal strength. Listing some of your personal qualities, such as being able to work well independently and in a team, or ability to remain calm under pressure, may be a suitable strategy for a newly registered nurse who are yet to join the workforce as full-time healthcare employers. Discuss knowledge-based skills such as language or the ability to train others in an effective tactic. For experienced nurses, apply for senior or leadership position. Transferable strengths such as problem solving or organizations are an asset regardless of position. Talk about the weaknesses. What are your weaknesses and be considerate. Don't mention any weakness that might make you not to get a job. For example, you can say you are somebody who is sympathetic. Even if nurses are always they are always advised to be empathizing, you can mention that. I think that one was helpful to you. So in case you feel that I've left some things and that I've not mentioned, kindly make sure you comment in the comment section. You can add anything that you want to add on this specific topic. So I think I've make some of you learn something. So let's meet in the next video. Bye.